Welcome back to my channel. Today we are going to have a brief discussion about neutropenia. Here are some important points that you have to remember for the in terms of examination view. So the Multinational Association of Supportive Care in Cancer (MASCC) risk index is associated with neutropenia. What is the normal value of neutrophils? 2500 to 7500 per microliters of blood. So 2500 to 7500 per microliters of blood is a normal value. Then if the neutrophils count in blood starts decreases, then what we call this condition as neutropenia, that is less than 1500 per microliters of blood. What are the causes of neutropenia? Bone marrow disorders, sepsis, tuberculosis, hepatitis, chemotherapy, autoimmune diseases. Okay, and we have classification of neutropenia: mild, moderate, severe, profound, and functional neutropenia. What is functional neutropenia? It is the impaired function of circulating neutrophils, which are seen in hemorrhagic malignancies. As we know that neutrophils fight against bacterial and fungal infections. Now we are going to discuss the algorithm for the diagnosis and treatment of fever and neutropenia. Whenever a patient comes to you with fever, you have to do prolonged fever for probably 7 days, greater than 7 days, or less, maybe 5 days. Okay, you have to do physical examination. Have to find any lesions on the skin, mucous membranes, IV catheter sites, perirectal area, and you have to do a complete blood count. When the granulocyte count less than 500 per microliters of blood, you have to suspect that this patient has neutropenia, and you have to expect the duration of neutropenia. Then you have to give this patient initial therapy. You have to treat this patient with broad-spectrum antibiotics that should be active against gram-negative and gram-positive Arabs. Then in the follow-up, after a few days during follow-up, you have to search for any infectious wound sites. If you found any obvious infectious wound site, you have to treat this patient with best available antibiotics that is available in your hospital. Broad spectrum antibiotics. Don't give narrow spectrum, because that's not going to be useful in this patient. So you have to give the broad spectrum antibiotics that should be active against gram negative and gram positive Arabs. But if you don't find any obvious infection site, you have to analyze this patient, whether this patient is in febrile or afebrile condition. But if the patient is afebrile, you have to continue the same regimen what you have given previously. But if the patient is in febrile condition, you have to add a broad spectrum antifungal, because probably the cause of the fever in this patient is due to fungal infection. Then in all the scenarios, continue the treatment until the neutrophil count starts increasing greater than 500 per microliters of blood for at least 2 days. Okay.